Thank you. Um, we want to let everybody know we appreciate the opportunity to be able to come to speak to you about such an important topic. Um, and this is really meant to be for you. If you've even if you've gotten your vaccine and you have questions, we know that you have family members or other members out there or friends that may have questions. So hopefully this will be helpful. And as I already stated, this is more like a town hall format. I'm going to take about 5 minutes to share a few things. I've asked my panelists also to take a brief moment to share a little bit more about their perspective. And then we want to just open it up to answer questions and see what we can do to help you with that. So the first thing I want to say, and I'm just going to be fairly direct about this, but one of the questions when you talk about healthcare is, does race matter? When you think about the healthcare experience in our country, the shades and shape of your shades and shapes do matter. How your hair looks, your European features, the color of your skin. And we know that we are facing, and this pandemic has really brought this out in a dramatic way, the systemic issues of racism, which also impact healthcare. Racism is a system, so it's not just about what we sometimes look at as hate or bias. It's about one group benefiting economically, socially, and politically over another group because of race. And we know from many, many years of study that there's been a significant disparity in healthcare as it pertains to health and even gender because of the systems that have been in place for so many years. So in that context, we've all lived through an incredibly crazy year, past year. Hopefully this year will be better. We know as of the beginning of February that almost 25 million, it's probably close to 30 million people who had the COVID infection. In New Jersey, it's probably close to 750,000 at this moment. And tragically, we've reached the 500,000 mark in terms of death due to COVID-19 or the coronavirus. Unfortunately, people of color, Blacks and brown people, have a disproportionate representation in this number. And that is a part of why we want to come and talk to you. Because we also know that when we look at the adjusted rate for mortality, and that is about 2 to 3 times higher in these groups. You would think because of that, we would be, including myself and all of us here who have color, excited to get the vaccine. But the reality is the systems of racism and the issues even in healthcare, such as the Tuskegee Institute experiment, helps us to realize that Blacks are 3 to 5 times less likely to take the vaccine compared to whites. And even when we look at the numbers at our institution, the Valley Health System, those numbers seem to follow the same trend. Even though many people in the healthcare system in Valley have access to getting the vaccine because of concerns and fear is there. And we also see that trend occurring in the Latino community, even in indigenous people, we see that same there. So what does this mean? We're here today to speak to 2 issues to weigh: wisdom versus fear. This is what this is about: wisdom versus fear. And we're here to encourage you not to base a decision about the vaccine on fear, rather to base it on wisdom. Even the question is, how do you decide that? How do you decide about this in this given historical context that I just talked about? So I guess we could get into a little bit if you want some of the facts. I'll leave that and we'll start answering questions. But what we do know, what I will tell you, is that we did not arrive at this vaccine in 10 months. Yes, in a sense we did, but the research on this has been going on for years, for decades. And in fact, in 2002, they already knew about the spike protein, which is used to, which is identified as a protein to stimulate our immune system. And we're already working on it. Second thing, with the clinical trials. The clinical trials, the Pfizer trial had somewhere between 9 to 10% African Americans or Blacks. The Moderna trial also had about 10%. The Hispanic Latino representation was between 20 to 30% in both trials. What's remarkable about that is that I've been doing research for years, and most of the clinical trials like this, you're lucky to have 1 or 2% people of color in these trials. We also know that the short-term results show that these vaccines work and they are safe. So finally, I would tell you, how do you decide? How does one decide? You want to weigh risk versus benefit. When I look at the risk of taking the vaccine, what is it versus the benefit? When I look at the risk of not taking the vaccine and the risk of COVID versus benefit. That's what we want to ask you to look at. The second, how do you do that if you're not knowledgeable and you're not a healthcare professional who has the training or knowledge about this? You need to seek trusted sources. That is part of why the four of us are on this call to hopefully help. But there can be other sources. In fact, there are even organizations in the country who are specifically committed to helping people of color when it comes to health, to have statements about the vaccine and about the coronavirus. So you want to listen to really credible people to get the information, and then base your decision not on fear, but on sound information. Try to take the emotion out of it. You know, racism victimizes all of us. And one of the factors in victimization is fear. And typically humans do not make good decisions based on fear. Often fear leads to very self-destructive choices. We're not saying you have to take the vaccine, but what we are saying, make a decision that clearly is based on information and truth and wisdom, not based on fear. So with that, I'm going to stop, and I'm going to maybe we start off with Dr. McGugins, and then we can just go down and let the panelists share a little bit of their perspective, and then we'll open it up.
I think I was muted. Hi, my name is Dr. McGugins-Hill. Thank you for having me as part of this panel. And yes, everything that Dr. Williams has stated is crucial in your decision making. I took the vaccine, the Moderna vaccine, which is 2 dosages. There was never a question as to whether I was going to take the vaccine. Yes, we are in the medical field. We're, at the forefront. We see, we continue to see and have seen the severity of this disease and the death toll firsthand. And we ourselves have, families, and we're out there, risking ourselves and our families. So there was never a question that the vaccine, whether or not I was going to get the vaccine. And, a lot of the information that has been put out on the vaccine, the science behind these vaccines are not new. The science has been around for, over 15, 20 years. So the safety is there, the safety profile is there. The benefit is definitely there. The efficacy, is there. And so, it was a clear-cut decision, for me to get the vaccine. My experience was fine. There are a wide range of side effects reported, as far as fatigue, achiness. I mean, basically similar as if you were to have the flu, but doesn't really last more than 24 to 48 hours. So clearly the benefit of protecting yourself and your family outweigh than the, self-limited, response that your body is having to the vaccine, which you actually want, because it then indicates that your body's immune system is responding to the way it should respond.
Thank you. Shakira?
Yeah. Hi, good evening. Thank you very much. Thank you for allowing me this opportunity to work with the panelists, Dr. Williams, and again, just to try to, And I like what you said, Dr. Williams. We're not here to make you get the vaccine. We're here to give you the information so that you can make an informed decision and decide whether or not the vaccine will work for you. I personally got the vaccine, and to echo what Dr. McGuggins just said, for me, there was not much to think about. We see what COVID has done. We see what COVID can do. As far as the vaccine goes, we know that the vaccine has gone through the appropriate clinical trials that they were supposed to go through. All 3 phases had been met. The vaccines had been found safe and effective. Once we have that information, for me, there was absolutely no question in my mind that I was not going to get the vaccine. I actually did get the Pfizer vaccine, both doses. Did okay, and not everyone will. Some people will have side effects. And I really want to be clear about this because I've had people say, well, you get the COVID vaccine and you can get COVID. And that's actually not true. The COVID vaccine is not a live vaccine. So therefore, you are not getting inoculated a live vaccine to give you COVID. You're getting a lipid covered mRNA, which is just a messenger. Okay, it's not going in to damage or destroy your DNA. It goes into your body and it does exactly what it's supposed to do. Give the message to the body to produce the spike proteins that you're hearing us talk about that is pathognomonic for the virus. Once that happens, that mRNA disappears. It cannot sustain being in our bodies. And this is why we have to store it at such low temperatures. It's gone. It does not go into the nucleus of your cell. It does not destroy your DNA. It goes and basically gives a message to produce that spike protein. So now your body is producing the spike protein. Your body is creating, along with it, memory T cell and B cell responses. And then you get neutralizing antibodies that come out of this process so that in the event that you're infected with COVID-19, you're able to now fight this virus. And so it's important to note that just as Dr. McGuggins stated, if you get the vaccine, I was fortunate enough, I had a little bit of soreness at the injection site, but that was it. Some people will feel feverish. They will feel achy. They may have a headache. That is called reactogenicity. Reactogenicity is very different from an adverse reaction. Have there been adverse reactions? Yes. Small numbers, and they are being reported and they are being studied and followed. But when we talk about, feeling feverish, body aches, headaches, usually, as Dr. McGuggins said, within that 48-hour time period, even that long. I think go up to 72 hours, but usually within the first day, those symptoms are gone. So for me, even if I did have side effect, even up to 72 hours, I'd rather take that side effect than deal with the consequences of being exposed and infected to COVID-19 and not being able to help fight it internally. So again, the decision for me was very, very clear. It was almost a no-brainer. It was, bring it on. Bring it on. We'll deal with the side effects. I know that this vaccine, the science has shown that it is safe and effective. And that's what I need to know. And so with that said, I think that, we have to remember that and remember that it has gone through all the trials that it needed to go through. And, you make your decision based on this information, part of it, at least.
Thank you, Dr. Slater.
You're welcome.
Dr. Pinto.
I am Dr. Pinto, gastroenterologist at Valley Medical Group. Again, thank you for the opportunity to participate in this panel. Hopefully we can alleviate some concerns of those in the community. Just to echo what everyone else has said, when the vaccine was available to me, I jumped at the opportunity to get it. I got the Pfizer vaccine, both doses. After the first dose, I had a mild sore shoulder, just like I always do with the flu shot. After the second vaccine, I was mildly fatigued, but I didn't have any significant side effects. But side effects were never really a concern for me. As Dr. Williams said, I think the main focus should be risk versus benefits. So the risks of having fever or feeling some fatigue for 24, even 48 hours was really a no-brainer in terms of the risk of getting COVID myself, or getting COVID and being asymptomatic and spreading it to my patients or spreading it to my family members. I think worst case scenario for me would be to infect someone else that I care about, or one of my patients, and have them be at an older age or have other medical conditions, and they're not able to survive the infection. So really, it was an easy decision for me. It was the best thing to do, not only to protect my patients, to protect my family, to protect my colleagues that I work with every day and see in the hospital and in the office, but also to protect myself. So I understand for us, seeing how COVID affects people, how many people have died, and seeing those effects up front in the hospital is kind of makes the decision a lot easier for us. For those in the community who are not in the hospital, not seeing people dying, not seeing people having long-lasting effects of COVID infection, it may be a little harder to really, kind of understand the severity of this. So for those in the community, I would say, just try to focus on risks versus benefits, and again, trust the science. 4 of us are here saying we have taken the vaccine, we haven't had any significant side effects, and we trust the science behind it. And if you have questions, we're here to answer them.
Thank you, Dr. Pinto. So what we want to do is open it up and see if we can just answer questions and address some issues you might have. I will just ditto that I took the Pfizer vaccine, and the biggest, effect I had was sore arms that last for a few days, but that was it. But other than that, it really didn't have any other issues there. So I think there's one question already in, and maybe you guys can answer this. The question was, is one vaccine better than the other?
I think I'll take this question. I think whatever vaccine becomes available to you first, take the vaccine.
Yeah.
Whether it be Pfizer, Moderna, I understand Johnson & Johnson will be probably soon. Whichever vaccine you can get, I would say get it. That would be my opinion. I don't know if anyone else has a different.
Yeah, I totally agree. Whichever one that is available to you. I mean, they're essentially the same. They both use the same, that is Pfizer and Moderna, the same technology, the messenger RNA technology. I think Pfizer is like 95, 96%, and Moderna is like 94, 95%. I mean, it's essentially the same. Whichever you are able to get. Mm-hmm.
Yeah, I would just ditto that. I agree. Let me ask a couple of questions here. So there's a question that sometimes it's not spoken but are thought of as, why do Black people and people of color seem to be getting COVID more frequently than other groups? What does that mean?
Yeah, that's a question that is continually asked when you look at transmission and environment. Black and brown people are not inherently susceptible to the COVID vaccine. There's nothing about our makeup that puts us at risk, our DNA makeup, or however you want to call it. It's more so, the environment, enclosed spaces, access to care, to even go get tested if you're feeling ill. So a lot of those variables, those environmental factors do, come into play with the numbers increasing. I don't know what my colleagues, would chime in.
I absolutely agree with that.
Yeah.
The access to healthcare. I mean, I think chronic stress has a lot to do with it. Unfortunately, that cumulative effect of chronic stress wreaks havoc on your immune system. And so when you are faced with a virus like COVID, you may not do so well. And then I also think, a lot of us tend to be essential workers. So, we have our bus drivers and our, postal men and women, and we're essential. And when we're essential, unfortunately, the essential workers are the ones who are becoming infected, unfortunately, sometimes bringing it into their homes where there may be another issue, where there may be extended family living in the home.
Yeah, the generational living.
It may be hard after you come in from a post office, or you come in from your medical facility or the bus terminal, to socially distance. There may not be that opportunity. So I think it's just like it's multifactorial reasons why our community tends to be hit so hard, if you will, with COVID. And I agree with you 100%. There is nothing inherent in us, in our genes, that makes us susceptible. It's just almost a perfect storm of things that may happen and cause this, unfortunately.
I know, I absolutely agree. I think being essential workers is definitely a big factor. Not having the luxury of, avoiding public transportation for those who are not workers, but those who have jobs where they cannot work from home. These are all big risk factors for, transmission. Also, just living in close quarters with others. We don't have a lot of times the luxury to spread out and social distance. So between that, and I think this pandemic has really just highlighted the existing health disparities that exist, or that were pre-existing. So having more comorbidities put you at a higher risk for having worse outcomes if you do get infected. So, a lot of these things are, as we said, social determinants of health that were pre-existing that are now just being highlighted by this pandemic.
Thank you. Yeah, this pandemic has exposed an issue that's been around for a long time, and many of us who practice medicine have been aware of healthcare disparities, just tragically and dramatically, because of the virulence of the coronavirus and how deadly it is. It has just blown this way out in the open, so that you can see the difference and the reasons why. But I want to just underscore, it's not based on genetics. You're not inferior. There's not some kind of gene thing that's making this. It has to do with your circumstances in life, whether you're to give you an example, I live in Ridgewood. A lot of people work in the city. They have computers. They stay home, right? I go to Valley. Many of the people who will the patients to their rooms, clean their rooms, they're people that look like me, and they're coming from like Newark and Patterson, right?
Right.
Who do you think is going to be more likely to get infected or be exposed? So that's kind of the reality of that. I have we got some questions, guys. So this is great. So after the first vaccine, how long does it take to reach a level of effectiveness, and what is that level? And the same question for the second vaccine. I guess the second, I'm assuming, means the second shot.
Oh, okay. So with the first, with the vaccination, essentially, what we're finding is that after a 2-week period, essentially the projected efficacy is there. So you still, again, have to socially distance, take precautions, whether you received one shot, both shots, just indefinitely until the recommendations change. But that 2-week window is a critical time post-vaccination where you are, still susceptible and not not protected. And the same goes for the second shot, that 2-week window.
Yeah, that's correct. I have a patient of mine who got the vaccine, but tragically 3 days later got COVID because it wasn't long enough for it to take effect.
Right.
To protect them. So that's really important to know, and that's true for the Pfizer and the Moderna vaccine for sure. So next question is, are there any effects with young people regarding reproduction, fertility?
So with this question, actually, it's a very good question and a very, very, very legitimate question. And a lot of young patients will want to know the answer to this. And the answer to this is that actually there is no evidence right now that suggests that a woman, it will affect the fertility, period. There is no evidence to suggest that at this moment. With this vaccine, as we're speaking, they are studying this vaccine. They actually, during the initial trials, there were patients who were involved in those trials who got pregnant, incidentally did become, pregnant. And so they are monitoring these patients throughout now just to solidify that there is no untoward side effect. But right now, per CDC, there is no reason to suggest that it will affect future fertility. But again, we have to remember that these are ongoing topics that are being looked at and researched and studied on a daily basis. So I would have, a talk with your OBGYN, your fertility specialist, the doctors who you are under their care, and go over risks and benefits as to whether or not you should get the vaccine.
Very good. Thank you.
You're welcome.
Next question is there significant information on the Johnson & Johnson vaccine? Is it being offered? I can say in terms of offer, I don't know, did it get approved yet? I don't know.
Tomorrow, I think, is official.
Yeah.
Yeah, it likely will, but tomorrow, I think, is the definitive decision. Yeah.
So that's still pending, but they're saying, so that vaccine will be just the one shot versus two. I mean, the way that it's kind of manufactured a little bit differently, using the adenovirus as the outer covering and not that lipid that the mRNA is encased in. And then they are saying that they're thinking that there may be decreased transmission. And that's what we're all concerned about.
Yeah.
The big question is with these vaccines, the Pfizer and Moderna, how infectious can we be to another person after we've received both doses? Can we still, if we become infected, we not have any symptoms because our antibodies are really fighting and doing their job, but can we still pass that on to our loved ones, our patients? So it seems to me from what they're saying, I don't know, we have to wait and see what the full data shows, that the Johnson & Johnson vaccine may be a little bit better in this department, but I guess we have to wait.
Yeah, that's a big point, Dr. Slater. And they were also, another arm of the research was looking at how efficacious the Johnson & Johnson would likely be against preventing hospitalizations. I mean, the overall percentage as far as, efficacy is a bit lower compared to Moderna and Pfizer, but that decreased transmission and that close to 100% hospitalization, preventing hospitalization, that's huge. Yeah. And the one shot, so if we're talking about access and, being able to get the vaccine to our community, having to go once is a heck of a lot easier than to have to go twice. So it's a really good option. Yeah.
Absolutely. Yeah. I agree.
I think the fact that it will be one shot is a huge advantage. And I believe the Johnson & Johnson one also doesn't require the low temperature. So in terms of storage and transport, I think it will be a lot more accessible, nationwide.
Yeah. And, from the comfort level standpoint too, because a lot of patients, also expressed reluctance because they think the messenger RNA is, this vaccine came about too fast, but the science behind it has been around forever. But with the, adenovirus science with J&J, that's like with meningococcal vaccine and the pneumonia vaccine. So, that may aid in familiarity to, patients and increase their comfort level.
So let me ask a little provocative question related to that. So we know the efficacies of Pfizer and Moderna is around 90-95%. We think that the Johnson & Johnson is probably going to be closer to maybe 70%, 70-80%. So as a lay person in the community, how do I know, especially as an African American or person of color, that they're not giving me an inferior vaccine as opposed to, should I insist on Pfizer? How should they think about that going forward?
That's a good question. That 75% coverage, especially if, say, the Pfizer and Moderna vaccines are not an option for that particular person or even available, that 75% coverage and that 90 to 100% decrease in hospitalizations, that's huge. And, so I wouldn't say that it's 100% inferior because it has added benefits that the Pfizer and Moderna vaccine do not have.
I would tell you personally, assuming the science holds up, I haven't seen the papers yet, but I would be willing to take it because there are so many additional factors
that's right.
It's like there's nuances so that you can't really compare these different vaccines head to head. So you want to sort of see what the experts say on that. And also the flu vaccine, just so you understand that we recommend getting every year, its efficacy ranges between 40 to 70% on any given year. And that's considered a pretty good vaccine.
Right.
That's 40 to 70%. So,
right.
so just so you understand that. So there's a question that just come up that about virus mutation, and should we be concerned, and why do viruses mutate, and how do we know if the vaccine is going to work with that? How should we think about that? Should we wait maybe until they get a better sophisticated vaccine, or how would you guys advise on that?
I would say that, virus mutates only when it's given the opportunity to mutate. So, when the environment is favorable and we've got, a lot of travel and we have maybe, unfortunately, not too much of the, the distance in and everything that we are recommending be done to help prevent this disease from spreading from region to region, we're going to see mixing. We're going to see variants, and variants are a reason to be a little concerned. But what they're saying is that the current vaccines that we have, there's no reason to suggest that they're not going to be effective toward these variants. But it is still something that, again, as we speak, they are actively researching and looking into.
Yeah.
Whether or not we're going to need, I think Pfizer is even working on right now a possible booster dose to address this very issue. As a clinician, mutants make me, I don't like to hear that. I mean, it is what it is. It's the truth. It's never a good thing when you hear about mutations, but again, there's no reason to suggest that the current vaccines that we have are not adequate enough, but they're studying it and they're working on it and trying to fine tune and see. We may need a booster, we may not. I think we just have to kind of wait and see where all the evidence and all the research goes with this.
Right. Totally agree.
Yeah. They the change in the mutations that occur are really part of biology. And almost all living organisms are changing. You're changing, believe it or not. We're all changing to adapt. That's part of how we survive. This is basically a race so that the more people, if we outrace by getting everybody vaccinated, then you can really handle these mutants. So it's a race between us successfully getting the world basically vaccinated versus the vaccine outpacing us with mutations. So that's why it's so critical that everyone gets vaccinated, because then even if you have these mutations, you can isolate them, and you can basically stamp them out and go from there. So that's just another thing that I would add there. So There is a question, what is the recommendation for people with lupus?
Mhm. Yeah, autoimmune conditions, that's definitely something that, the CDC and a lot of the medical community, continue to address. And, there has not been a statement put out as of yet where getting, vaccinated is a contraindication for, with patients that have autoimmune conditions.
Yeah, yeah.
Mhm.
So a lot of these, if you have unique medical conditions, we certainly encourage you to speak with your physician.
Mhm.
They should be knowledgeable to help you with that. But
Mhm.
most situations, you're still going to be recommended that you get the vaccine. But you can certainly get the information if they know you well, particularly if you have a family practitioner like Dr. Slater or an internist like Dr. McGugins. They can help you navigate that.
Right.
Here's an interesting question, guys, and maybe I'll have Dr. Pinto answer this first. It says, I trust science. My concern was, and it still is a little, that the vaccine was created so quickly when we heard about it happening. It was basically what they're saying is it was created too fast, too rapidly. So anything you can tell me to help me feel better about the timing?
Right. So, I think the main thing to know is that if you do trust the science, know that this science was not created, just this year or just in the last, 10 months when these vaccines were created. They've been working on, this science for quite a long time. The fact that we would have a pandemic like this has been well known amongst the medical and public health community, and it's something we've been preparing for a long time. So the fact that the vaccine was available a little sooner than maybe we expected, I think is definitely a good thing, at least in my eyes, definitely very welcomed. Um, the science is not new. The trials all went very well. The efficacy is beyond what I personally ever would have expected or even hoped for. As we said, the flu shot is, closer to 50 to 70% effective that we take every year and trust every year. So I think the fact that we were able to produce this a little faster than anyone expected, um, all of that is based on the strong science that has been, in research and well researched before this pandemic even started. So, if you do trust the science, then look at the literature, look at the trials, and again, leave your trust in the data. You don't have to depend on your personal or others' skepticism about the timing of the vaccine. The science speaks for itself.
That's what's so great about science, right? Because science is objective, it's not, subjective, or rather shouldn't be. So and then also just with all, that's transpired in the past that probably, factors in on apprehension, in our community to get medical care or get vaccinations. We have such stringent protocols in place and monitoring and regulatory agencies in place to put anything out. And so definitely, trust in the science, like Dr. Pinto said.
Yeah, that's great. You should also know that in the Moderna virus development, that one of the key investigators was a Black female, a woman named Dr. Corbett.
Mm-hmm.
And she was really at the forefront of the development of this. So I think there is some leadership, even of color, in helping these vaccines come to the market.
Mm-hmm.
There was a question here in the, let me see if I have it here. Yeah, there was a question asked, is there any mutation specific to Black people related to this virus or vaccination?
No, not that I'm aware of, no.
Okay.
Absolutely not that I'm aware of.
Yeah. Okay. And will you need to get the vaccine every year like the flu shot?
I don't think we know yet. This is such an evolving, right now the priority is just trying to get a significant amount of people vaccinated. So we kind of develop this herd immunity type of, scenario. But we don't know yet.
If you test positive for the antibodies, do you still need to get the vaccine?
Absolutely, you should.
Yeah.
So even if you test positive for the antibody, the recommendation is that you still get the vaccine because we don't know how long that natural immunity lasts, right? And that's the whole question. We don't know if a patient's had COVID, they've recovered, they have antibodies. We don't know how long those antibodies will last. And so getting the vaccine is that added layer of protection. And yes, the answer is yes, you should get the vaccine.
So here's kind of what we know. We know that short term, in approximately 6 months to a year, we know that these vaccines are safe and that they work, at least on the strains that are out there. What don't we know? If you look down the road 2 or 3 years, we don't know what that means yet. But yet, when you weigh the risk of the coronavirus and what we've actually seen personally in the hospital against the benefit of these 2 vaccines and possibly a third, it still makes sense to take it. So we know that short-term things it seems to be quite safe and also seems to be very effective. Will we have to take the vaccine in the future? Are there issues we're unforeseen? That's why there's ongoing research to try to understand that.
Yeah. And it's almost like that. We almost don't even have the luxury of worrying or overly concerning ourselves about the long term with regards to efficacy. When you look at, over 500,000 deaths already, and then over 2 million, there's over 2 million globally deaths. And that's just under a year since the pandemic started. So, getting that protection now is key.
Here's an interesting question. It says, if herd immunity does not occur, will it be necessary to be revaccinated?
That's a good question.
A good question. So what the definition of herd immunity? So that is where we immunize, as many people as we can immunize in hopes of being able to, for those people who cannot be immunized for whatever reason, basically protect them and prevent this virus from infecting our bed of protection. So in a sense, we're creating like a blanket, if you will, of protection by getting our vaccines so that we are not now we're not, transmitting virus from one person to the next person to the other person. And that person who could not get that immunization for whatever reason, maybe there was a contraindication, we're hopefully in turn protecting them and putting a blanket over them also. So, to answer your question, about the herd immunity and whether or not we'll have to be revaccinated, I don't know that I know the answer to that. But I don't know if anyone else can chime in on that, whether or not they have
Right.
heard.
We don't know. Essentially, with the statistics that we have, anywhere from 75 to 80% we would need vaccinated to even achieve that.
Right.
I think that the fact that, this is not just a United States disease, this is a global pandemic, hence, the term, pandemic. And so if we don't achieve, herd immunity, whether we achieve herd immunity or not, the recommendation for getting vaccination, I don't think should change. Because if you look at, the Moderna and Pfizer vaccine versus the Johnson & Johnson potentially could minimize transmission. That's not necessarily the case with Moderna or Pfizer. But then if you get the majority of the population vaccinated, then that level of protection goes up independent of what vaccine you get. So I definitely, sitting to see whether or not herd immunity is achieved to determine if you're going to get vaccinated yourself, I wouldn't do. I would definitely get vaccinated. Yeah. Because the next person may be thinking the same thing.
There was a report today via CNN about Africa and a new strain. Does it, does anyone know anything about the new strain or can discuss it at all?
I didn't see that report today yet.
Yeah.
Yeah.
I think we partially addressed it in terms of mutations. What I can tell you is there are going to be mutations ongoing until we get on top of this. And I think you just need to get, the strong recommendation is to go ahead and get the vaccine, because part of my challenge with the news, you want the information, but they're going to sensationalize and keep everybody in a panic.
Yeah.
But viruses always mutate. That's just part of the reality. So,
Right.
so calm down, try to do what you do, focus on the things you can control, and let the scientists just worry about typing the mutations, because there will be ongoing. Can pets contract the virus?
I think so. I haven't heard, there was like early on, there were reports about like from a vet about a cluster of dogs getting it, but I had not heard honestly anything from that time period on.
Yeah, it's hard. It's hard to know. I haven't heard anything too. What's interesting though, we think the virus came probably initially from a bat to an animal, such as a domestic animal or farm animals to humans, but it's very difficult usually for that to transfer back. And so I have not heard anything either, but I don't know, Dr. Pinto, Slater, any of you guys heard anything? No.
No, I have not heard anything.
So maybe we can use this. I mean, we certainly will welcome more questions, but we're kind of wrapping up. So I'm going to throw this out, and each of you can try to address this. But someone sent this out as for us to comment. Can you emphasize how important it is, if not to protect yourself, but to protect those you love, those you work with, those you live with?
Absolutely. Actually, the latter part of that is the reason why I got the vaccine.
Yep.
To protect my patients, to protect my family, my children, to protect my husband, to protect my parents, who we haven't really been able to see, and just be that one piece of the puzzle. And it's just a small piece, but it's still a piece of the puzzle that will help us get to hopefully a sense of normalcy at some point. Okay. And so I absolutely, that's why I did it. I did it not for me. I did it for my patients, my family. And that's why it was really a no-brainer to make this decision. I couldn't bring anything to them.
Right.
And they'd be defenseless.
Yep.
You know, my kids are under 16. They will never they're not going to get this vaccine anytime soon, right? Both of them are. And so, I really had to protect them, our patients that come in here. I want to feel confident. We have all the PPE we need. We are fully stocked. We have everything we need here, but I want to be able to walk into a patient room confidently and know that my risk of transmitting whatever I may be asymptomatically carrying will not happen. I can decrease that risk with the patient. Okay. And so that was the reason I got the vaccine. That's it.
Yeah, totally echo that. I mean, absolutely. And when you see, the severity of it, we've seen it, firsthand, and to think that if you got infected, did not know, and we have the privilege of seeing and taking care of people, if we potentially would have been responsible for transmitting the virus to someone, and we know we know what this thing does. We know what it does, the severity of this disease. That's something you have to be able to, if you have it in your power to prevent, you're going to prevent it. You're going to prevent it. And, and we're parents, we have partners. So coming home, you have to come home and, be with your family. And so the protection, getting protected, getting this vaccine, it's a necessity. It was a necessity for me.
I completely agree. Like I said, I think for all of us, it was a very easy decision. Um, I think for people in the community, the thing to focus on is if you have some reluctance based on whether you trust the vaccine or you think it was produced a little too quickly or you're worried about side effects, you know, focus on doing it for others. Do it to protect your friends, your family, your parents, your grandparents, people you come into contact with. Because, contracting it yourself and becoming ill, that's one thing, but to give it to a loved one and be responsible for spreading COVID, I don't think there's anything that's a worse feeling than having that. I think that's even amplified even more for us as physicians. We are in this line of work in this career to help people and help them feel better. Um, to think that we would bring harm, first do no harm is the motto that we live by. So that made our decision very easy. So if people in the community would take that same stance and, essentially just think of others before yourselves. If you're worried about having a little fever and fatigue, but on the other side, you weigh that against protecting your kids, your parents, your grandparents, the decision becomes very easy.
Okay, good. Thank you. All right, guys, I got two more questions. Rapid fire here. Uh-oh, another one came in too. But let's try these rapid fire. One question is, what about diabetes patients, the effects? Is there anything about diabetics? One, should they get the vaccine? Is there any concern if they get the vaccine in terms of reaction?
And no contraindication. They should be protected and get the vaccine. Yeah, they're more at risk for complications if they don't.
Great, great. And what's the youngest age to get one should consider getting a vaccine?
So 16 for the Pfizer and 18 Moderna at this point.
And then someone said Lysol, we know, kills the virus. Is there a point where you can use too much of it? Also, after being vaccinated, should this routine be something to continue? Should you still use Lysol, I guess, to clean things? So first of all, don't drink the Lysol.
I knew that was coming.
But
do not ingest it, please.
Right.
Try not to inhale too much of it either.
It's true, yes.
Right? Open a window.
But for cleaning purposes, it's okay, right?
Oh yeah, yeah. That's totally fine. That I promise I'm not. That's funny.
So I think we're getting close here. So I'm gonna just share a couple of closing remarks here. I wish we had more time. You guys have been really great. I'm glad we could answer. I had the opportunity to try to answer some of your questions. I'll share you two vignettes. First, I have a cousin who decided to drive her 86-year-old mom down south to a family reunion in which 8 people stayed in her home for 7 days. They all got sick. They all got COVID. When she came back to Illinois, grandmother was put in the hospital and she did not survive. Mm-hmm. My cousin is ripped with guilt because of this. Mm-hmm. Even though not everything was in her control, we know life happens, but part of the point is if when you love, you need to think, why would I turn down the vaccine? Truth versus wisdom. Mm-hmm. I have a patient in the intensive care unit now who was doing all the right things, staying home, etc. Her granddaughter went to the mall. The granddaughter was actually wearing a mask, but apparently got COVID through her eyes because she didn't have goggles or glasses on. Mm-hmm. Came home, everybody got infected. The young granddaughter is doing fine, but grandmother is in the intensive care fighting for her life. Mm-hmm. These are the reasons why it's so important to base your decision on wisdom, not fear. weigh the risk versus the benefit. I took the vaccine first. I tried to look at the information. And these trials that have been done have been unusually high in representing people of color. Not perfect. And it doesn't mean there's not racism and other systems in play in some of these issues, but these have been unusually in that they've had better representation.
Mm-hmm.
And I believe the data. And as all these other doctors said, I would feel really bad passing this on to my patients or someone else. Number two, I'm a grandfather. I got 3 grandkids. I haven't been able to see them for a whole year. I'm tired of it. I said, if for no other reason, I'm getting a vaccine. I don't want to make them sick. But more importantly, a lot of your young people will do fine with the vaccine. They'll just come take you out.
Right.
You know? And so for those reasons, those are my reasons for doing that. So I wanted to just thank the panelists for all that you were willing to do and coming and being a part of this and all the information that you shared. It's been awesome. I want to thank Collegial Care and Valley Hospital for helping to sponsor this, the 2 organizations that we're a part of. I also want to thank Pastor Nobles and the Mount Bethel Baptist Church and Pastor Brandon and the Metropolitan AME Zion Church and your leadership in allowing us to be able to come and try to connect. As you see, there's more of us than just the 3 of us. Some may even be on this call. We are healthcare providers who, through this pandemic, were looking for a way to make a difference against social justice and racism as it comes to healthcare. One very low-hanging fruit that's so important right now in our country is vaccinations. And so because of that, we're here. If there are other opportunities, if there are other groups or churches or other things that you think would be worthwhile us doing something similar to this, please do not hesitate to reach out to us or reach out to Valley or Collegial Care. And if we can do it, we'll really try to set it up. But I'm going to turn it back over to Valley and the moderators that set this up. And it's been our pleasure. And I hope this really helped. And please take what we shared back to home and talk to your people, especially your young people. We know they're all on the internet. That's where they get all their information. And, you know, half that information is crazy, right? So they need to be able to have something that has, remember, trust the source. They need to have information coming from a reliable source. Yeah. And thank you.
Thank you, everyone, for joining us this evening. And I'd like to echo Dr. Williams' thanks to all of our presenters, and special thanks to Dr. Williams for putting this panel together. If you're interested in future Valley Live events, please visit valleyhealth.com/events for upcoming programs. And we also have a listing of videos on other health topics at valleyhealth.com/tuneintohealth. Thank you, everyone, for joining us, and have a wonderful evening.
Can you say one thing about vaccinations at Valley? Just
vaccinations at Valley.
How, if they were interested based on age or whatever, what
Yes.
can they do given how crazy it is?
So right now, Valley is vaccinating about 1,000 people a day. We have a vaccination center now set up. If one of the, we're really trying to reach older adults, especially those who don't have computer access. So if you know someone who's older, who doesn't have computer access, you can certainly call me. My number is, you know what, I'll put it in the message here. I'll put it in the chat. It's 201-291-6218. And these are for people over the age of 65 who don't have computers. We're vaccinating what the state guidelines are. So it's first responders, healthcare workers, and people over 65 and other people who are at high risk. And the other high risk people include people with breathing issues. So if you have asthma, if you have COPD, or congestive heart failure, significant heart disease. Those are all considered at-risk population, people with diabetes especially. Yeah, so availability, what's been happening with the appointments is they release appointments on Valley's website, but they also do it on Facebook and Instagram. So when they release appointments, people are seeing it on Facebook and Instagram quickly. So you have to act quickly to get a spot. And certainly if people have any questions, they can call me. I put my my name and number in the chat box. So, okay. I hope everyone has a great evening and be well.
Thank you.